In your health headlines, you may have seen more mustaches around this time of year. It's because the Movember movement is underway. It was started to bring awareness to men's health issues, including prostate cancer, by growing a mustache. Dr. Mitchel Goldman with UCSD is here now to talk more about it. And you're freshly shaven. I have to take note. Well, how did this whole Movember kind of phenomenon come about?
Well, as you know, Kathleen, men really don't take care of themselves very often, and people don't realize, but prostate cancer is actually more common than breast cancer, with 1 in 7 men getting prostate cancer and about 27,000 men in the United States dying each year from prostate cancer. So this is a very significant condition, and so this Movember is basically a way to get men to be more aware of the fact that they really have to be careful about their prostate.
Yeah, prostate cancer, the primary focus here. What exactly is it, and why does it seem to catch so many men off guard?
Well, the prostate is this gland that basically sits in our pelvis and lubricates, especially semen that comes out. And what happens is, as you get older as a male, the cells of the prostate can actually become cancerous, just like breast cancer can become cancerous as you get older. But the biggest problem is the symptoms are not that amazing, and so what happens is sometimes there's like less urination or interrupted flow, or it's difficult to urinate, or the key one is blood in your semen. But all of these symptoms that we're seeing here can also happen from infections called prostatitis and some other conditions called benign prostatic hypertrophy. So if you are having symptoms or know of men that have those types of symptoms, it's very important to see your doctor, because there's 2 simple tests that can be done. One is actually a digital exam where the doctor actually feels the prostate to see if there's any nodules or lumps in it. And the other is a blood test called a PSA, for prostate-specific antigen.
And Dr. G, let me ask you real quickly, at what age should men be doing that?
You know, interestingly, it's more common in African American than non-African Americans. And so the American Cancer Society recommends that African American men actually get checked at age 45. The rest of men about age 50. But it's important to share that with your doctor, and your doctor and you can both figure out when the best time to get checked, and also how to get checked. Because again, the digital exam is probably the best way, but having your PSA taken every year or 2 for Caucasians after the age of 50 and for African Americans after the age of 45 can help prevent the development or catch the prostate cancer very early on.
And the Movember movement, quite frankly, a fun way to draw attention to something that's really serious.
I know, so I'll have to do something about my mustache.
That's right. It might take you till December, but you keep us posted. Dr. G, as always, great to see you here, and for such an important cause as well.
Thank you, Kathleen. Bye-bye.